isolated. A lot of people know about North Korea that way. We use data that was gathered with support from UN agencies. And this is the first visualization that we have. This used data from the 2008 census of North Korea, table 18. And we visualized the maternal mortality rate. And the reason why we chose this variable is because MMR is used extensively by a lot of organizations, like WHO, to kind of give an insight into the status of the health of the women in different countries. And MMR is defined as the number of women who die from pregnancy-related causes per 100,000 live births. And if you look at this visualization, it's a map of the DPRK. The provinces that are displayed here are coded in different colors depending on their level of MMR. At the top of the legend, the bar, the deep green, 85 to 90 of MMR, and the province with the highest maternal mortality rate is Giang, and it's in this area of the country, so kind of up north. Then the province with the lowest MMR, between 65 and 70, is actually the capital city, Pyongyang, so down here, more towards the southern part of the country. And I would encourage you to keep in mind this trend where the capital city seems to have a somewhat better health status compared to the rest of the country. And we took the same data, but we look at the percentage of maternal deaths in hospital. The other places that can have people dying at home and elsewhere, according to the data. So the hospital is only one category. And if we look at this data, the capital city, Pyongyang, down here, actually has the highest percentage of deaths at the hospital. And these three provinces, Giang, South Hamgyong, and Kangwon, form a series of three provinces that seem to have lower percentage of deaths at the hospital. So what does it mean? We looked at the topography of the country to try to explain what is happening here. Up here, the bigger circle, represents the location of Giang. So if you remember, two visualizations ago, Giang is the province with the highest MMR. And the citizens happens to be at a place where the location is very mountainous. And our observation is, or our guess, I should say, is that maybe that location makes it difficult for the citizens of the country to get to the hospital. So maybe that's the reason why we saw a high number of maternal deaths, but a low percentage of that actually happened at the hospital. Then the capital city, Pyongyang, enjoy a somewhat sea level kind of structure, so they have lower maternal mortality rate, but they have higher percentage of deaths in the hospital. And we think that maybe it even brings about a more important question that needs to be addressed, that is the quality of the health facilities in developing countries. Because even the capital city, Pyongyang, it is the lowest maternal mortality rate, and it's still between 65 and 70. That's still pretty high, and it's already the lowest in the country. And something needs to be done to address that issue. Then we have two more visualizations in this series, and I'm just going to go over them quickly. But the key idea is that we're going to see the same trend over and over again, where the capital city, Pyongyang, seems to have the better health status. This is chronic malnutrition in children, and the capital city, Pyongyang, has the lowest prevalence, whereas the province, Giang, has the highest. And it's interesting because if you look at this map, it seems like as the provinces get further away from the capital city, the prevalence of global chronic malnutrition seems to increase. And the global acute malnutrition seems to have the same trend as well, when the capital city has the lowest prevalence, and as you get further away from the capital city, the provinces seem to suffer worse conditions. This raises the questions of what is happening in North Korea, where the capital city is experiencing such much better conditions compared to the other provinces. And that is a question specific to the country. So that concludes my series of data visualization from about North Korea.